According to the American Society of Plastic Surgeons, breast reduction surgery removes excess fat, glandular tissue, and skin to alleviate pain and discomfort that's caused by large breast. We spoke with Dr. Ameen Habash at Desert Regional Medical Center in Palm Springs to learn about breast reduction surgery.
Breast reduction are one of those things that years ago were felt to be purely cosmetic. And then as the understanding of not only the medical complications of having large breasts, but also the psychological impacts and those types of things, it started to become more of a considered a reconstructive procedure. And often now, about 60 to 70% of the breast reductions that I do are covered by insurance.
We asked Dr. Habash what medical conditions warrant breast reduction surgery.
Women come in with chronic back pain and neck pain, trying multiple over-the-counter prescription medications, even going to physical therapy, tried weight loss, and still has not resolved their symptoms. And those are women that really are candidates for a surgical breast reduction. And they come in and say, I've tried all this, nothing has worked, I need something done.
How extensive is the breast reduction procedure?
The technique itself, once again depends on multiple factors. The degree that we have to reposition the nipple, the extent of breast tissue we're trying to remove, and the extent of skin laxity that we have. That will determine the extent or the location of the scars. The key thing here is we want to maintain the nipple and the nipple sensation during this procedure. And so as we do a reduction, simultaneously we do a lift as well. And depending on the extent of those things that I'd mentioned earlier will determine which surgical approach to take with them. The surgical procedure itself takes about 4 hours. It's an outpatient procedure. They go home the same day for the most part. I see them the next day to not only take their dressings down, but sort of discuss what was done, how much we removed, and sort of the course of that point. At 7 to 10 days, most women are off narcotic pain medication, really have a substantial improvement of their overall symptoms, and are getting back into their daily routine.
We asked Dr. Habash, at what age do you recommend women have breast reduction surgery?
And the breast tissue changes its position, the nipple changes its position, which can be affected by having children, weight gain or weight loss. And so there isn't really a set time frame or age in which women have this done. It really depends on, once again, the extent of symptoms that they're having. And it's one of those surgeries that usually women come in and say, I've been dealing with this for 5 years and now I'm ready for this. Most women are incredibly happy with the results. It's odd because most women come in and all they want is resolution to their symptoms. Rarely do they talk about the cosmetic appearance of things. And resolving those symptoms for women is essential. Being happy with the shape of the breast is equally essential. So it's one of those surgeries that we do that really fits under the criteria of both cosmetic and reconstructive.